and the ranking member, of course, for allowing me to sit on this subcommittee hearing and allowing me to speak on one of the bills being considered today, my legislation, which is H.R. 2628, the Vet Care Act. Many of my veteran constituents have come to me over the years expressing their desire to add dental care to the VA's medical benefits package. As you know, Madam Chair, the VA currently only provides outpatient dental services to a limited number of the disabled veteran population who have 100% service-connected ratings. And then there are a couple other categories as well, POWs, and again, anything that happened on the battlefield as far as if it's service-connected regarding the mouth area. But some of my, again, some may be eligible. Some veterans may be eligible for the VA dental insurance program, which provides a discounted low-cost insurance plan provided by private insurers. But I believe we can do more to move this issue forward. And I commend you, Madam Chair, for filing your bill as well. I'm very supportive of your bill. Many small studies suggest that regular dental care equates to lower overall health care costs and better health outcomes. One such study, published in the American Journal of Preventive Medicine, conducted by the University of Pennsylvania professor Dr. Marjorie Jeffcoat, found that regular periodontal checkups lead to reduced hospitalizations and overall medical cost savings in care for chronic conditions such as heart disease, cerebrovascular disease, including stroke, and diabetes. And again, I think there are more chronic diseases that are affected as well. In light of these results, I worked directly with Dr. Jeffcoat and Dr. Zach Calorico, who is a constituent of mine from Wesley Chapel, Florida. We worked to develop the parameters and replicate this type of study at the VA by authorizing the Vet Care Act. H.R. 2628, my bill, expands on this research to help determine the potential health benefits to veterans and potential cost savings to the VA associated with periodontal care. The Vet Care Act would require the VA to create a 4-year pilot program to provide dental services to 1,500 veterans diagnosed with type 2 diabetes. Each treated veteran will receive appropriate periodontal evaluation and treatment on an annual basis during the pilot. Throughout and at the conclusion of the pilot, the overall health of the treated veterans will be recorded. These results will be compared to veterans who did not receive treatment to determine if providing veterans with dental care equates to fewer complications of chronic ailments. If so, an analysis can be done to determine if the lower costs of the overall health care due to fewer chronic ailments saves the VA enough money to reallocate funds to provide more veterans with dental care. It makes sense as far as I'm concerned. The data recorded and collected by the VA would also be able to be distributed to the research community for further study. Finally, at the end of the pilot program, the 4-year pilot program, veterans who participated in the program will receive administrative support and information from the VA on how they may continue to obtain dental services and treatments in the community for low to no costs, including information about enrolling in the VA DIP program. Now, I want to thank the nonprofits and the dental associations that offer care to our true heroes as well currently. In this way, we can ensure that we are providing continuity of care for veterans in need of further treatment. To conclude, if we're able to improve the VA healthcare system by providing preventive dental services that lead to fewer complications of chronic ailments, it not only shows that we are looking at the long-term outlook of our veterans' health, but it could also prove to be done in a cost-effective manner. The Vet Care Act is a practical, common-sense way to demonstrate this approach for dental services replicating already established research in the community. Again, I thank the chair and I thank the ranking member for bringing this bill up for discussion at today's hearing, and I look forward to continuing the conversation further. Thank you, and I yield back, Madam Chair.
Thank you, Mr. Bilirakis, and thank you for your work on this important measure, and I am hopeful that we'll be able to find a